Hello all, I'm Matthew DeClerc with Hippo Education, and I'm joined remotely by my colleague Matthew Delaney, also of Hippo Education. We are doing EP Monthly May 2020 in the middle of the COVID crisis. Matt, I actually wanted to talk to you about this article because you did a piece just recently with Mike Weinstock about COVID and the medical legal aspects of it. And this one is the Federal PrEP Act provides some COVID immunity from liability by Bill Sullivan. And what it's basically saying is there's an act that was signed. We are in the middle of a pandemic. There's going to be some stuff that we're going to do as healthcare providers, as people trying to fight this pandemic, that may have some negative consequences, but as long as we're doing them out of the goodness of trying to fight this and in good faith, we should be covered. Is that correct?
Anytime a lawyer is involved or the government is involved, the devil really can be in the details. So this article does a really good job, I think, of breaking down what this act potentially can do. So we do seem to have some enhanced medical legal protections, but it's not an umbrella policy. So unfortunately, we're still potentially at risk of medical legal kind of accusations and lawsuits. So I think for all of us, we're practicing in fast changing, uncertain times. This is a good read to kind of understand what's out there to try to back us up a little bit.
Yeah, the first part of the article really was that. It was written by a lawyer. It just states all this law. It wasn't until it got to the second part that William was able to kind of explain some of this stuff to me. But a good read. It's going to be really interesting to look back on this period of time and kind of flesh out all the details of how the healthcare system really dealt with this on a social, medical, legal, policy level. It's really a time of big education. So